Hello guys, welcome back to my channel. Today we are going to learn oral mucosal drug delivery system. So if you are new to my channel, please subscribe my channel and press the bell icon for the further notification. And let's see ahead with this topic, that is oral mucosal drug delivery system, and we'll see many of the things. We'll learn a lot of different preparations from this system. So let's begin with it. The overview of oral mucosa. The total surface area of oral cavity, that is lined by mucous membrane, is near about 100 centimeters square. And if we talk about the several parts of the oral cavity, they are the floor of the mouth, the sublingual part, the buccal mucosa, that is cheeks, and the gums, that is gingiva, and the palatal mucosa. So here these are all the parts of the oral mucosa. Now the question arises, why we need a buccal drug delivery system. So this system is absolutely desired for the absorption of water soluble drugs which are poorly acting, that is poorly water soluble drugs. For this, first of all, we will enhance the water solubility of the drugs by forming a complex with the cyclodextrin like substances, the substances which increase the solubility. So this also increases the absorption of that drug in the buccal mucosa. Next is the buccal mucoadhesive requirement. So an ideal drug delivery system should possess the two main properties, that is spatial placement and temporal delivery. For spatial placement, we need for targeting drug to a specific organ or tissue. For temporal delivery, for controlling the rate of drug delivery. So let's see the general consideration. For a buccal drug delivery device should have the following size, that is 1 to 3 centimeters square, and the daily drug dose should not be more than 25 mg. And if we talk about the shape, then the ellipsoid or circular shape are the most acceptable shapes for the buccal drug delivery. Now, if we talk about the pH, then the pH of buccal devices should near to be neutral or to the pH of the saliva, that is 6.6 to 7.4. Now let's see about bioadhesion. The bioadhesion can be defined as a state in which two materials, at least one must be biological, that is the mucous oral cavity, are maintained together for a prolonged time period by means of interfacial forces. Now if we talk about the various forms, then the various forms which are available are the solid, micro and nanoparticle systems based on the chitosan and derivatives, which have been the focus for several studies. There are also microemulsions which are thermodynamically stable. These are prepared by incorporation of bioadhesive molecule like polycarbophil, colloidal dispersion of bioadhesive polymers. These are the basically frequently used preparations in the semi-solid system. Next is a liquid crystalline macrophages can be built, and hydrogels which can increase the contact time between the preparation and the mucous membrane after they undergo in situ gelation. Now, so this is about the mucociliary clearance system. In this, there is a system called mucociliary clearance. What does it mean? It means a natural defense mechanism for a body against the disposition of impurities onto the mucous membrane. So simply we can say that all of the impurities, all of the foreign material which comes in contact with the mucous membrane, then this mucociliary clearance system remove them. So basically the mucosal membrane of the human organism are relatively permeable. That means they allow the movement, that is fast drug absorption takes place, and the mucus contain glycoproteins, lipids, inorganic salts, 95% of which water by mass, and making it highly hydrated system. Therefore, mucin is much most important glycoprotein of mucus which is responsible for its structure. Now we will see the mechanism of mucoadhesion. So the mechanism of mucoadhesion involves two different stages, that is the contact stage and the consolidation stage. In the contact stage, the dosage form comes in contact with the mucous membrane. So you can see in this diagram the mucous membrane, mucous layer is shown on which the dosage form comes and try to bind. And the consolidation stage, there is an interaction area seen. So in this interaction area, the drug penetration as well as different binding activities are seen. So let's see deeply the first stage. What is the first stage? It is characterized as the contact between mucoadhesive and the mucous membrane. Therefore, the spreading of the drug molecule over there, the swelling of the formulation and the deep contact with the mucus layer is all about first layer. So, how it does? So, basically the particle approach to the mucous surface and they come in contact either by repulsive forces or there is attractive forces. So, if it is repulsive forces, it is because of osmotic pressure and electrostatic repulsion. And if it is due to attractive forces, it is van der Waals force of attraction and electrostatic attraction. Therefore, they form a specific bond together. Now, next is the second stage, that is a consolidation step. So, what happens in this? The mucoadhesive material which is attached to the mucous membrane is activated by the moisture, and this moisture, what does it do? It plasticizes the system. Therefore, it makes rigid the drug molecule. Therefore, the mucoadhesive molecule to break free and to link up by the weak van der Waals force and hydrogen bond. The two theories involved in this are diffusion theory and dehydration theory, according to which if the mucoadhesive molecule and the glycoprotein of the mucus mutually interact each other, then they form a strong bond by the secondary bonds. And according to the dehydration theory, the material readily jellifies, means it becomes rigid, it becomes strong. Why? Because the aqueous environment of the mucus. And when it placed in contact with the mucus, it causes dehydration of that mucous membrane and itself gets swell up. So, this difference in concentration gradient draws the water in the molecule and the molecule due to osmotic balance is swelled. This is a diagram for this. So, in this diagram we can see the mucous membrane is there and the mucus layer shows the movement of water towards the molecule, and this mucoadhesive dosage form which is attached to the mucous membrane becomes hydrated, and this is shown that hydration region of formulation, and the dehydrated becomes the mucus layer. Therefore, the molecule becomes swell because of the water movement from the mucous membrane. Now we will see the design of the buccal adhesive dosage form. So for this design there are three types we have seen, type 1, type 2 and type 3. The type 1 is saying that it seems the pink color is showing the drug loaded bioadhesive layer and the blue color is showing the impermeable backing membrane. The backing layer does not allow the movement of drug molecule from that specific part, and the arrow is showing the direction of movement of drug. In type 1, the drug is loaded in the mucoadhesive layer and the drug is surroundly movable in all directions. While in type 2, there is movement along only 3 directions. Why? Because of the presence of this backing membrane which inhibits the movement of direction in one direction. And type 3, the movement is inhibited by 3 steps. Now let's see the theories. The theories said that the process of mucoadhesion is mainly based on formation of two types of bond. This is chemical bond and mechanical bond. So chemical bond is this covalent bond, weak secondary bonds and ionic bond and hydrogen bond. And the mechanical bond is due to it is similar to that of the interlocking system. Therefore, on the basis of nature and strength of these two kinds of bonds, there are different theories for mucoadhesion as per the mechanical bond. So, we will see the different theories that are under the mechanical bond. So, let us see the first theory, that is electronic theory, due to which it is because of the electronic structure of the transfer of electrons which occurs between the two systems. Which two systems? That is the mucin surface and bioadhesive system. So, there forms an electronic transfer. How is this? This is possible because of the formation of electronic bilayer. So, this electronic bilayer which is formed at the interface between these two surfaces allow the transfer of electrons, and this bilayer exerts an attractive force between these two surfaces for mucoadhesion. Next theory is adsorption theory. What is it saying? That the mucin and the drug delivery system, they have their own surface energy. So this surface energy results in the formation of two types of chemical bond. Because of this surface energy, the bond which is formed as covalent bond, van der Waals forces and hydrophobic interaction and hydrogen bonding. This covalent bond is the permanent bond and is strong in nature, whereas other bonds like van der Waals, hydrophobic and hydrogen bonding are comparatively weak in nature. Thus, they produce a semi-permanent bond. So, this was all about the adsorption theory. Now, let's move ahead with the wetting theory. What the wetting theory is saying that This theory is only applicable to the liquids and low viscous mucoadhesive system. According to this theory, the active components penetrate into the surface irregularities and gets hardened, and finally mucoadhesion takes place. So if basic terms, if we say that lower the contact angle, greater the affinity. You can see in the diagram the mucous membrane is shown and the contact angle between the product as well as the mucous membrane is seen. The first one is a 0 angle, another one is greater than 19 and another one is less than 30. So in the diagram we can say that less the contact angle, like if 0 is the contact angle, then greater the affinity and mucoadhesion takes place firmly, strongly. Whereas more the angle or less the angle from 0 deviating, then it is less the adhesion. Next theory is diffusion interlocking theory. According to this, the adhesion forces increases with the degree of penetration of polymer chain. So this says about the role of polymer chains. The penetration rate depends upon various fundamental points like diffusion coefficient, flexibility, nature of the mucoadhesive chain, mobility and the contact time. You can see in the diagram the mucous membrane is there, mucus is there, and when the drug comes onto the surface, then penetration takes place. So you can see the polymer chain in the product is going to interact with the mucus and therefore they form interaction and interlocks them. Next is fracture theory. The fracture theory is saying that the force required to detach the polymeric chain from the mucin layer is the strength of adhesive forces. This is basically saying that how to remove that mucin surface from the product, how to make it free. And this fracture, this is all about telling about adhesion, how form the adhesion as takes place. For this we have formula like G is equals to E into E upon L raised to half. So either G is the fracture strength and E is the Young modulus of electricity and another E is fracture energy and L is the critical crack length. In this diagram we can see the mucus is there and the adhesion takes place and the force required to detach is the fracture energy. Next there are factors affecting mucoadhesion. So there are many factors, out of which first of all the polymer related factors like molecular weight, we need high molecular weight, concentration of molecule, flexibility, more flexibility, spatial conformation, swelling, hydrogen binding capacity, cross linking density and charge. All these are polymer related. And next is the environment related factors like pH, we need optimal pH for this, we need a high strength, applied strength, we need moisture environment, then initial contact time is more important, we have seen. Now physiological factors, the mucin turnover, more the mucin, less will be the interaction, the clearance will be more, rate of renewal, disease state, tissue movements and concomitant disease. So the next one is the buccal mucoadhesive drug delivery system. So there are three, that is sublingual delivery, either buccal delivery or local delivery. So these three are the basic delivery system for buccal mucoadhesion. Next we will see the advantage of this system. So the basic advantages include the local as well as systemic delivery is achieved. Then it is easy to apply as compared to other adhesive dosage form. Increase the patient compliance, easy to use. Actually patients don't prefer injectables more. Then it is the most preferred delivery system for local treatment of the drug. Therefore it is preferred. Now let's see limitation. What this theory has not done. So basically the bitter taste drugs cannot be taken since we are taking from mouth. Then the drugs which irritate oral mucosa cannot be taken. The allergic reaction and discoloration of teeth cannot be formulated. Now antimicrobial agent would destroy the natural microbes also cannot be used. Now discomfort while eating, drinking, speaking cannot be tolerated, and the only drugs which are absorbed by means of passive diffusion can be used by this route. Then unstable buccal pH cannot be used. The degradation of moisture sensitive drugs may take place due to saliva. So these are the limitations. Next come the disadvantages of this system. So low permeability of buccal membrane is basically for this sublingual membranes. Now smaller is the surface area for this system. The continuous secretion of saliva can remove the drug. This leads to subsequent dilution of the drug, like 0.5 to 2 liters per day saliva is secreted. For this the dilution can take place of the drug. Now swelling of the saliva can also potentially lead to the loss of dissolved or suspended drug, and ultimately the involuntary removal of the dosage form will take place. Therefore we can lose a drug. Therefore these are the disadvantages. Now let's see what basic components in designing of the drug delivery system we have to do. So these are the drug substance first of all. The drug the dose must be less than 25 mg. The short biological life drugs can be used for this like 2 to 8 hours. Then drugs having fast metabolism can be used for this, since the drug will not move to the liver for the first fast metabolism. Then the bioadhesive monomer. Next one. For this bioadhesive polymer, it should be inert. It should be compatible with the environment, and it should adhere quickly with the mucous membrane. And adherence would be long lasting for required time. So the basic moiety we have seen adherence. If more the adherence, more the effectivity of the drug. Next come the properties of the packing membrane. The packing membrane we have seen in the previous diagram. What is saying that it has to prevent the drug circulation in another parts. So it should be impermeable to drug as well as mucus in order to prevent the unnecessary drug loss. Then the preparing packing membrane should be inert, insoluble, and should have low water solubility. Example for this: ethyl cellulose, carbopol, sodium alginate, HPMC, and polycarbophyl. Next come the plasticizers. What does the plasticizer do? They improve the folding endurance of the delivery drug. In simple terms, they have to fold the drug. They have to allow the drug to be placed sufficiently in the mouth. They provide the flexibility to the dosage form for improving the patient acceptability and compliance. Example for plasticizer are PEG 400, PEG 600, dibutyl phthalate, and propylene glycol. Next is the permeation enhancers. Their basic role is, these are the chemicals or liquid used to improve the permeation of drug from the device in the mucous membrane. More the easy the permeation of the drug from the mucus, more the activity is seen. The basic mechanism ahead the permeation is, they reduce the viscosity of mucus by increasing the fluidity of lipid bilayer membrane, and by countering the enzymatic barrier, and by increasing the thermodynamic activity of drug. So this is the basic mechanism ahead this permeation membranes. So these permeation enhancers are most important in while preparing this delivery system, because we need the drug to be reached to the mucous membrane. Let's see the classification of buccal dosage form. So there are solid dosage form, buccal tablets, bioadhesive wafers, bioadhesive lozenges, and the semi-solid include the bioadhesive patch, film, buccal gel and ointment, and the medicated chewing gum. And the liquid dosage form include the suspensions. Now this is the example we have seen. The drug is placed between the gums and this cheek part, and we will see the just applied drug, no dissolution. After 2 hours, the starting dissolution is seen, and then after 4 hours, the drug again more dissolving, and after 6 hours, the drug is dissolved much more. We will see that the lifespan for this drug, for the biological half-life, is much more than compared to other, like short biological half-life we have seen in advantage part. So 2 to 8 hours is taken by this drug to dissolve completely and set an action over there. We will see the just applied after 2 hours and after 4 hours and after 6 hours what happens to the drug. Now we will evaluate the buccal mucosal system. There are different methods which include the in vitro, ex vivo methods, then in vivo methods which is also known as buccal absorption test, and in vitro release study. So these all are different evolution techniques for this buccal mucoadhesive system. In the in vivo methods of evolution, we have seen different methods like the gamma scintigraphy techniques, the GIT transit using the radio opaque technique, the moisture absorption studies for buccal patches, the thickness, the swelling study for the tablets, the folding endurance by the plasticizers, the surface pH study, and the retention time. So this is the various in vivo methods of evolution. Now we will see the other in vitro methods. They include the rheological study, the colloidal gold staining methods, and the fluorescent probe methods. These are the in vitro methods for the study of this biological bioadhesive system. And this is all about the reference that I have used in order to make you understand this specific part. So stay connected with me, and I will post more and more videos for your help. So thank you for watching this video, and please share, subscribe my channel as well as like my video, and please comment down if you want me to specific part of the drug or any part to be understood by you, and I will make video for you. Thank you.